So patient's name is Kidir, 55 years old, works as an office worker and previously worked as a factory worker. He had complaints of aching, cramp, and large varicose veins on the lower right extremity on the cuff area with heavy and trembling character, which has been persistent for 15 years and has increased in pain intensity, especially when he's standing or sitting for too long. He had additional complaints of tingling, swelling of leg that appeared 5 days ago, and darkened color of skin on the calf region and muscle fatigue. The changes became prominent after he changed his career from a factory worker to an office worker. And one thing to note is that both his parents had varicose veins before. And upon physical examination, he had satisfactory condition with glaucoma scale score of 15. He also had forced posture after a few minutes of standing. He is considered hyperstenic and has excess subcutaneous development. Upon inspection of every other system, you're not compromised. So going on to the local status will be in the peripheral vascular disease. So it is location on the right calf region, which can be seen dilated tortuous vein, redness of skin, elevated temperature, and hyperpigmentation. There's presence of edema on the calf, foot, ankle, and there's a decrease in muscle strength in right lower extremities with asymmetrical development and muscle wasting of the right leg. So small amount of hair is present on legs and there's slight bitterness on the toes. And upon palpation, temperature is warm and there is pain upon touch. Cough impulse is present and saphenous femoral junction pulsation is present. So a preliminary diagnosis second stage of varicose vein. And in lab examination, patient has mild leukocytosis, decreased platelet, and also decreased ESR. Patient also has decreased bleeding, clotting time, decreased PT, APTT, INR, and this indicates the patient has impaired hemostatic system. Next, for instrumental tests, we have given them duplex scanning, in which the result shows faulty saphenofemoral junction with venous reflux. We have also given plethysmography, in which it shows venous reflux. So our final diagnosis is second-degree chronic venous insufficiency with primary varicose vein and superficial venous thrombophlebitis. The classification is C4 for hyperpigmentation, edema, and varicose vein, P for primary, S for superficial, and T for thrombosis. And upon final diagnosis, we have decided to send patient for surgery of ligation of saphenous femoral junction or cresectomy. And the treatment given was infusion of normal saline on cubital access. Heparin is given to reduce the blood clotting. We have given them ibuprofen to ease pain, compression socks, and also Foley catheter. So the indication for surgery is life-saving to prevent further progression of disease into ulceration and deep vein thrombosis. Patient has no contraindication. Patient also has high risk of bleeding, thromboembolism, and blood clotting. And we have given him a local Novocaine block for anesthesia. So in preoperative checklist, vital signs are all within normal range. Patient has no allergies and was given premeditation 2 hours prior to surgery, and checklist is completed. For intraoperative surgery, the surgery is expected to start at 10 a.m., starting with prepping of skin and local anesthesia of local Novocaine block. And around 10:30, ligation of the saphenous femoral junction is done, where patient is given compression stockings to put on, and the wounds are sutured with primary intention of healing. And then the patient is transferred to the patient ward to be continuously monitored for his vital signs, and the surgery is expected to complete at around 12:30 p.m. 12:30 p.m. So in postoperative day 1, the monitoring starts at 1 p.m. and this monitoring will last for every 15 minutes during the first hour and then every hour until the next day. So we can see that the vital signs are stable. The skin is pale but became normal in few hours. The swelling can be seen during the first few hours but reduces gradually within time. we can see that the patient feels pain, so we have given them ibuprofen to ease the pain. Um, we are also giving them heparin or anticoagulant, which they will continue for a week. So 3 hours after surgery, laboratory tests was taken and result shows their hemostatic system has greatly improved. And for the entire duration of the stay, patient has to wear the compression socks and do light movements to stimulate circulation. And patient was also given a full meal of boiled meat and vegetables to promote faster healing of wounds. And the monitoring continues until 12 a.m. So on the second day, the monitoring starts at 6 a.m. with interval of every 3 to 4 hours. And during the entire time, patient's vital signs were stable. And meals were given 3 times per day. So patient no longer feels any pain and there's no longer any swelling. Skin is back to normal skin color. However, compression socks are still on, and another laboratory tests were taken, and the result finally shows normal hemostatic system. And so, by third day of post-surgery, again monitoring starts at 6 every 4 hours, and changing of wound dressing was done at around 1 p.m. and patient are finally discharged at 1:45 p.m. Thank you.